Good evening, I'm Steve Hensley. Our weather team has been warning us about possible high winds increasing our risk for fires, and we've already heard about several brush fires in our region and surrounding states today. Our severe weather alert day continues. Meteorologist Evan Hatter has more on what to expect tonight. Evan?
That's right, Steve. We just clocked the highest wind gusts we've seen so far throughout this event just a few minutes ago, and that's why we do have the wind advisory in place as we head through the remainder of tonight. That goes into effect, or it's in effect, and runs through early tomorrow morning. Everybody is under this wind advisory. Everybody is also under the fire weather warning. You may also see this as a red flag warning. That's the technical name for it, but it essentially means that we're combining low humidity, warm temperatures, and gusty winds to create the potential for brush fires to get out of control quickly. We're under the critical fire danger from the Storm Prediction Center this afternoon. Wind speeds between 10 and 20 miles per hour in many spots. Monticello right now sustained 26. There's our new highest gusts. We've just gusted to 44 in Hazard, 44 in Jackson, 43 in Monticello, 44 in Richmond. So we are seeing those winds start to gust even higher. Temperatures around the region, very warm, upper 70s, low 80s. We're nearly 20 degrees above normal today. We're not tracking anything on pinpoint Doppler in terms of rainfall, but I want you to notice a few areas right now. One into far southeast Breathitt County. That's likely that brush fire. Another one into portions of Perry County. That's already kind of worked its way through, but you see these smoke plumes working on through, and we've been watching this smoke plume on the Lee-Scott County, Virginia line throughout the afternoon. That's likely a rather large fire. And of course, we've been monitoring ones in Johnson County and also down near the Gatlinburg area in East Tennessee. They've been seeing quite a bit of fire activity this afternoon. Not to be limited to that, we're watching strong to severe storms getting going to our west. Several tornado warnings, including a few not far from Jackson, Mississippi. So a busy weather evening out there. Keep that WYMT weather app handy as we head through tonight. We'll have the very latest on those storm chances working in, as well as the potential for some finally quieter weather moving in. That's coming up in just a few minutes. Steve?
All right, Evan, thank you. March is Colorectal Cancer Awareness Month. For an Illinois congressman, it is a personal mission to spread knowledge about this deadly disease. Washington News Bureau's Nicole Newman reports.
More than 27,000 blue flags are flying in the wind on the National Mall. Each one a representation of the number of young adults predicted to be diagnosed with the battle Illinois Congressman Rodney Davis is familiar with.
My wife, Shannon, is a 23-year colon cancer survivor. Luckily, we found it at stage 2.
March is Colorectal Cancer Awareness Month. According to the National Cancer Institute, colorectal cancer is now a leading cause of cancer death in both men and women ages 20 to 49 in the United States. By 2030, diagnosis for young adults is expected to rise from 18,000 to 27,000 annually, as estimated by medical researchers. While researchers have yet to fully understand what's causing an increase in cases, the Institute says there's been an uptick since 1995. The U.S. Preventative Services Task Force recommends adults begin screening at 45 years old. Angie Davis is the president of the Fight Colorectal Cancer organization.
And one of the asks we have of our policymakers is to increase screening and increase federal funding.
Davis says lawmakers are working to remove screening barriers.
We've been working with the National Institutes of Health. We've funded the National Cancer Institute and the NIH with historic funding over the last few years.
In December 2020, the House passed the Removing Barriers for Colorectal Cancer Screening Act. It's now stalled in the Senate. In Washington, I'm Nicole Newman.
During the pandemic, we saw very few flu cases, but with restrictions being lifted, numbers are starting to pick back up here in the Commonwealth. CDC research reports that flu cases in some states were at low levels the week of March 12th, but increased to moderate levels the next week. The Kentucky Department of Public Health reports around 3,500 cases this flu season so far.
We're not as concerned about wearing our mask. We're not washing our hands as much. We're not paying as much attention to social distancing.
Health experts say flu prevention is key. They still recommend getting the flu vaccine and the COVID-19 vaccine if you have not already. As reporters peppered him with questions, President Joe Biden received his second COVID-19 booster shot at the White House today. The FDA approved the booster shot for people 50 and older. Earlier, the president announced the launch of his administration's new COVID website. That website, covid.gov, is a one-stop online resource for information about vaccines, tests, treatments, and masks. CDC research is showing that the Omicron subvariant that caused COVID-19 cases to skyrocket in the UK is now the dominant strain of the virus here in the United States. Mandy Gaither has more on what region is being hit the hardest and what experts say we should be doing now.
BA2, the highly contagious Omicron subvariant, now accounts for nearly 55% of all COVID-19 cases in the U.S., according to the latest data from the CDC.
We know that this new subvariant BA2 is even more transmissible than the original Omicron variant, and it is spreading quickly.
The hardest hit region continues to be the Northeast, where BA2 is the cause of more than 70% of all new COVID-19 infections. Health officials warned BA2, coupled with lower mask use, may cause an uptick in cases in the U.S.
But I hope that there will be enough people vaccinated, combined with prior infection and recovery, that we'll be able to decouple infections from hospitalizations, and our hospitals are not going to be overwhelmed.
Right now in the U.S., COVID-19 hospitalizations are near their lowest point ever. Still, health experts say we need to be prepared going forward.
We have to make sure that we stockpile treatments, that we have enough testing, we also have enough booster doses. We have to prepare for what happens if we have another surge.
The FDA has now expanded the emergency use authorization of the Pfizer and Moderna COVID-19 vaccines to allow adults age 50 and older to get a second booster as early as 4 months after their first booster dose of any COVID-19 vaccine. But the CDC says only about 29% of those fully vaccinated have gotten the first booster.
And that should be the priority, to get people initially vaccinated and then that additional booster before we talk about a fourth dose.
Well, the South and Mountain West are seeing the fewest cases of COVID in the U.S. In those regions, BA2 is causing slightly more than 1/3 of infections. The battle against COVID-19 is still moving in the right direction. CDC researchers published their COVID-19 statistics today, predicting the average number of daily deaths will drop in the next 4 weeks. But more than 14,000 people are still expected to die from COVID-19 in the next month, and that is slightly higher than the prediction made in last week's ensemble forecast. But it's still one of the lowest projections this year. Itching to go on a cruise but nervous about COVID? Here's some good news from the CDC. It just dropped its risk assessment of cruise travel. For more than 2 years now, health officials have been warning folks not to go on a cruise. But considering where we are in the pandemic right now, and since COVID-19 cases on cruise ships have been dropping during the past several weeks, the CDC decided to give cruises the green light. Of course, this does not mean there is no risk. The CDC says you're better off vaccinated, and you should research how each cruise line handles public health measures. Spring break at the Louisville Muhammad Ali International Airport is likely to be the busiest ever. Travelers are encouraged to arrive early to make sure they get through the airline counter and security. From Thursday, March 31st to Monday, April 4th, nearly 35,000 departing seats are scheduled for the 5-day period. The most popular state to visit right now, no surprise, Florida.
Check the TSA website to see what you can and can't bring in your bag. That's where a lot of people get hung up, is in the checkpoint because they didn't pack properly. So make sure you pack right, show up early, bring some snacks for the kids, keep those devices charged up, and just bring a little bit of patience with you, and hopefully you have an excellent spring break experience.
Due to high passenger volume, be prepared because the parking lot there in Louisville may be full or intermittently closed. The Great Resignation, as many are calling it, has folks reevaluating their lives, their priorities, and determining what they are really passionate about. Molly Ricketts of Incipio Workforce Solutions in Louisville recruits top talent for businesses. She says she's never seen so many people leave their careers. Interested in why, she started doing some research and learned they all had one thing in common.
It was when their personal and their professional worlds collided. So the stress was at a different magnitude that they weren't able to manage any longer, and something had to give.
Since November, a record number of 4.5 million Americans quit their jobs. Coming up on Mountain News at 5:30, new research is showing there are fewer horse racing deaths. We take a look at what's being done differently than before.
Hey, continuing to watch the potential for strong storms in the mountains later tonight. I've got the latest and when those storms could move in coming up next.